Hello, my name is Cassie McCoy, and today I will be presenting Racial Disparities in Access to Pediatric Medical Homes, an analysis of the National Survey of Children's Health 2019 to 2021. A medical home is defined by the American Academy of Pediatrics as an approach to primary care that is comprehensive and high quality and is built upon forming strong partnerships between families, clinicians, and community resources. The AAP defines a medical home as accessible, family-centered, continuous, comprehensive, coordinated, compassionate, and culturally effective. Access to medical homes has been associated with positive health outcomes and quality measures. Some of these include increased preventative care services being utilized, increased well child checks, increased rates of immunization, and increased rates of having vitals recorded at well child checks. This has also been associated with decreased outpatient sick visits, decreased cost per patient, as well as decreased inappropriate antibiotic usage. Given that the AAP has defined a medical home as the standard of care, we wanted to assess for racial disparities within access to this model. To do so, we analyzed the National Survey of Children's Health, which is a nationally representative survey of children 0 to 17 that is completed annually by a primary caregiver in the home for that child. It covers a variety of health topics, and for the purposes of our study, we focused on a subset of 16 questions that were given in the NSCH codebook as defining access to a medical home. These 16 subset questions were then categorized into 5 criteria that you can see here in Figure 1. These are the 5 criteria that had to be met in order to be considered to have a medical home. These included having access to a personal doctor or nurse, having a usual source of sick care, having no difficulties obtaining referrals, receiving effective coordinated care, and family-centered care. Family-centered care covers more of the cultural and compassion components that are in the definition of medical home mentioned earlier. First, we determined the rates of having access to medical homes overall and the 5 components that you see there for all children and by race. To assess for disparities, we constructed a logistic regression model and measured associations via odds ratio between racial minority groupings as well as access to medical homes. In this model, we controlled for the variables that you can see here listed in Table 1, which include child sex, age, the federal poverty level, caregiver education level, and urbanicity. Overall, we found that significant disparities are in place for the majority of children, as 53.12% of children lack access to medical homes. This is especially true for minority children, where we found that compared to white children, each minority group, with the exception of multiracial, were statistically significantly more likely to lack access to medical homes. This is highlighted here in Table 2 in our logistic regression model, where you can see in bold each of the racial ethnic minority groups were statistically significantly more likely to lack access to a medical home compared to their white counterparts. Overall, we found that Native Hawaiian Pacific Islander children exhibited the greatest disparity in lacking access to medical homes. And we found that 72.58% of these children lacked access to medical homes, and also had Native Hawaiian Pacific Islander children overall had the greatest lack of access for 4 of those 5 components. Hispanic Latino children also exhibited a large disparity as having the greatest rates of lacking access for difficulties obtaining referrals. But again, overall, we found that each racial minority group had statistically significant increased likelihood of lacking access to medical homes. Given that the majority of children overall, with the 53.12%, lack access to medical homes, efforts are needed to provide our pediatric population with this more comprehensive and quality care by providing care that meets the definitions of medical homes. The most prominent barriers to obtaining medical care were found to be access to personal doctor or nurse and usual source of sick care as the highest unmet criteria. Given that minority children are more likely to lack access to medical homes, efforts are needed to reduce the disparity and access to this quality of care for our racial and ethnic minority children. To do so, we recommend that addressing systemic barriers and the physician shortage in order to increase the receipt of medical homes and improve overall health equity for our children. Thank you so much.